on to health care. A new study says most Americans won't see their insurance premiums change. That as Congress debates the proposal. Lizzie O'Leary has all the numbers for us in Washington. Lizzie?
Hey, Scarlett. Yeah, this is analysis from the nonpartisan Congressional Budget Office. They took the bill the Senate has started debating and they spun it out to about the year 2016 to get a sense of what you and I and everyone would pay. So if you get your health insurance in a large group, that's a company with more than 50 employees, it looks like your premiums would essentially be the same to 3% lower. If you get your insurance from a small group, a small company, 50 or fewer people, premiums range. They go either up 1% or down 3%. And then individuals, if you buy on the individual market, your premiums would go up 10 to 13%. But here's the thing. It costs more largely because there's better coverage. But because the government, and this is a little complicated, is going to throw in some subsidies, people would see their actual costs lowered because of the subsidies. That nets out to more than half of folks in this market paying 60% less than what they would. It's important to note this is a pretty small group. Most people get their coverage through their jobs, so the individual market's pretty small. So in terms of what all these numbers mean politically, it's pretty much whatever your opinion was before they came out, you can find something that appeals to your opinion now.
Healthcare reform is fundamentally about lowering healthcare costs and making quality healthcare affordable for all Americans. Lowering costs is what healthcare reform is designed to do, lowering costs, and it will achieve this objective. How? In many ways.
So that's the Democratic take. The Republicans say this bill is actually going to increase premiums for American families. You can bet that this is going to go back and forth about whether this bill that's sold as a way to reduce costs actually does that, Scarlett.
Now, Lizzie, it's been a while, so give us an update on where things stand right now as the reform bill winds its way through Congress.
Yeah, winds its way is really the right way to phrase this. You saw there that was a snippet of debate from yesterday afternoon. They've just started in the Senate. It could be weeks. So the president's spokesman said he still intends to sign a bill by the end of this year. We know that Congress and the president are running up against a pretty hard deadline pretty quickly, Scarlett.
Lizzie O'Leary for us in Washington.